Good morning. We're going to talk about systemic, endocrine, and metabolic disorders next. System is made up of glands that produce and secrete hormones, which are chemical substances produced in the body that regulate the activity of the cells or organs. They regulate things like the body's growth, metabolism, which is the physical and chemical processes of the body, and sexual development and function. The major glands of the endocrine system are the hypothalamus, the pituitary, the thyroid, parathyroids, adrenals, pineal body, and the reproductive organs, the ovaries and testes. The pancreas is also part of the system, and it plays a role in hormone production as well as in digestion. So the hypothalamus is located in the lower central part of the brain. You can see in this picture right here. And this part of the brain is important in the regulation of satiety or feeling full, metabolism, and regulation of body temperature. The pituitary gland, which is also up here, is located at the base of the brain beneath the hypothalamus and is tiny. It's about the size of a pea. And it's often considered the most important part of the endocrine system because it produces the hormones that control many other functions of the endocrine glands. The pituitary is divided into two parts. It has an anterior lobe, which produces the growth hormone, which stimulates growth of bone and tissue, the thyroid stimulating hormone, which stimulates the thyroid gland to produce thyroid hormones, the adrenocorticotropin hormone, which stimulates the adrenal gland to produce several of steroid-related hormones, luteinizing hormone, which is important for sexual function, as well as follicle-stimulating hormone, which is also related to sexual function. Both are related to the estrogen and progesterone production and function. Prolactin is also part of the anterior lobe function, and that is the hormone that stimulates milk production in females. And the posterior lobe produces the antidiuretic hormone of vasopressin, which controls water loss by the kidneys. It also is responsible for producing oxytocin, which is important for childbirth. It helps the uterus to be able to contract, also stimulates milk production. So that's all with the pituitary gland. The thyroid gland is located in the lower front part of the neck, okay, right here. And it produces the thyroid hormones that regulate the body's metabolism. It also plays a role in bone growth and the development of the brain and nervous system in children. This gland controls the release of thyroid hormones, which help maintain normal blood pressure, heart rate, digestion, muscle tone, and also reproductive functions. The parathyroid glands are two pairs, you see here, the green, of small glands embedded in the surface of the thyroid gland, a pair on each side, and they release the parathyroid hormone, which is important in regulating calcium levels in the blood and bone metabolism. We also have two adrenal glands, and these are triangular shaped glands located at the top of each kidney. They're made up of two parts. So the outer part is the adrenal cortex and the inner part is the adrenal medulla. So the outer part produces hormones called corticosteroids, which regulate the body's metabolism, the balance of salt and water in the body, regulation of the immune system, and sexual function. The adrenal medulla, which is the inner part, produces hormones that are called catecholamines. One example of a catecholamine is adrenaline. And these hormones help the body cope with physical and emotional stress by increasing the heart rate and blood pressure. The pineal body or pineal gland is located in the middle of the brain, You can see right here, pineal gland, which secretes melatonin, which is a hormone that helps to regulate the sleep-wake cycle. The reproductive glands, so the testes and the ovaries, secrete the hormones called androgens. That's in the male hormones, androgens. And the hormones affect male characteristics, sexual development, growth of facial hair, etc., as well as sperm production. In females, the ovaries are located on both sides of the uterus and produce estrogen and progesterone as well as eggs. So these hormones control the development of the female characteristics, breast growth, and are important for reproductive functions such as menstruation and pregnancy. And finally, the pancreas is the elongated organ right here toward the back of the abdomen behind the stomach. It has digestive and hormonal functions. One part of the pancreas, which is the exocrine, secretes digestive enzymes. And then also the pancreas plays a role in secreting insulin and glucagon, which help regulate the blood sugar levels in your body. So when we're taking an endocrine system history, it's important to get some information. You know, in general, has the person experienced fatigue and lethargy? So in part, you would expect to see that as a result of the normal aging process, because the endocrine system produces and regulates hormones, and these hormones decline with age. You want to find out if there has been any skin changes, because fluctuations in hormone levels can cause skin and body imbalances with negative consequences. So it's not unusual skin conditions develop as a result of endocrine dysfunction. You may also see some diaphoresis or some abnormal sweating because, as we've talked about, the endocrine system is responsible for the regulation of body temperature and metabolism. Breath odor is another thing to consider. In particular, people with diabetes have inadequate insulin production, which can lead the body to burn fat, which is known as ketoacidosis. This leads to an increase in ketones, which the body attempts to eliminate through urine in the lungs. And that can lead to breath that has like a fruit-like odor or an odor like acetone. Acetone is a byproduct of ketone production. You also want to look at polyuria. Have they had an abnormal volume of urine, abnormal thirst, which is polydipsia, or polyphagia, increased hunger, which are all really common in endocrine disorders, particularly diabetes. Also want to look at arthralgia, which is joint pain. So have they had any joint pain? Or myalgia, muscle pain, which is associated with several endocrine disorders. Is there any loss of their menstrual cycle, amenorrhea, or impotence? In men, is there an inability to get or maintain an erection? Again, as you can see, this would be related to endocrine dysfunction. And also confusion. Confusion can be related to blood sugar disorders or other endocrine disorders. So also in the history taking, a lot of the endocrine disorders have a strong familiar history, such as diabetes. You also want to consider social history. Stress can exacerbate some of these symptoms. Environmental factors, they don't really know what causes some of these endocrine disorders. So, there's some relationship to environmental exposure. And then you want to consider the timeline on symptoms and disease progressions. How long have these symptoms been occurring? Have they steadily been getting worse? Is it something more acute, that there's been a rapid decline? So you want to find out all of those things. You also want to complete a physical examination. Look at their skin, their hair. Is the thyroid enlarged? Is there any tracheal deviation? And we talked about this earlier. I did post 2 videos here. I'm not going to show them right now. You can go back and look at them, but it's conducting a thyroid self-check. So really looking at, does your thyroid deviate to one side or the other, indicating there may be either a growth or some other reason for that deviation. Also want to, palpate the skin, palpate the hair. Is there any sweating? Look at the thyroid again, and include the vital signs, and always be sure to include weight, because with some of these endocrine disorders, you can see an increase or a decrease in weight without a reason for that increase or decrease in weight. Usually it's a decrease without trying. So in terms of medical testing, typically people undergo a blood sugar testing, lab work, ultrasounds, and those vital signs. In terms of blood sugar, the typical procedure is a finger stick. That's been around for a long time, and it's a self-monitoring method of measuring blood glucose, and that's using the kit, the strips, and the meters. A1C tends to be used more medically. It's a common blood test to diagnose both type 1 and type 2 diabetes and then gauge how well it's being managed. So it tends to result in, it gives you an average blood sugar level for the past 2 to 3 months. The A1C test measures the percentage of your hemoglobin, which is the protein in your red blood cells that carry oxygen, measuring how much it is coated with sugar. And the higher the A1C level is, the poorer your blood sugar control and the higher the risk of complications related to diabetes. Also, ultrasound is used often to identify tumors on some of the glands, such as the adrenal or the pituitary glands. And then there's a variety of lab work that might be done to be able to identify specifically where some of the issues might be.